If you hadn't received the boost and you did what Councillor Riel said, is go right through, spend all your contingency, what would we not have? What would the effect of that be on the community?
So the first point I guess I'd say is that it would impact service because it would impact staffing levels. About 83% of our costs are staffing costs. So if
what service would it like?
So where we go first, I mean, we are driven by our standards that are set by the province. So we have requirements in terms of what we have to do, whether it's inspections, whether it's outbreak management, and whether it's education sessions even. So when we look at those kinds of things, the protocols that tell us how many we have to do, those programs would likely get protected because they have immediate impact. The flexible areas where we have in our mandate is more the chronic disease prevention kinds of program areas. Now, that's where you would get into questions about, well, what's a minimum level of service for that?
And the city has to, I mean, you have to be able to provide a minimum level of service.
Yes, but how you define that minimum level of service is probably where you could have open debate. Now,
what is minimum?
For the last number of years, you could look at our board quarterly reports, and you would see that we report to our board on a quarterly basis that we're not meeting all of the requirements for those chronic disease prevention and injury prevention programs. We're not doing as much as we feel we should. So we're already below what we think is minimum. The new standards try to give us more flexibility so you could cater your programs to the local needs. And that's a good thing. But the problem is, the more flexibility you have, that means it's also a risk of being cut. So if it's flexible, that means you can take it off the list.